Breast forms. First, we review patient forms. We collect patient-reported outcomes using forms before treatment, at the end of treatment, and during follow-up. Breast patients who agree to participate in MROC can either agree or disagree to complete surveys. If a patient declines to complete surveys, please ask the patient if they are still okay with being enrolled in MROC. If given their approval, then CDA and provider forms should be completed on the patient. Each patient survey has a corresponding cover letter that should be provided to the patient. There is also an MROC brochure that can be shared with the patient. CDA forms. CDA forms should be completed at baseline and 3 months after the patient completes treatment. We ask that information captured on the CDA form be entered into the MROC database within 2 weeks. Each CDA form has a corresponding data dictionary that will help you answer each question correctly. Here's an example of what a data dictionary looks like. If you look at question 3 at the top, the bottom snippet from the data dictionary outlines some possible medications that the patient could have been prescribed. The first form you will complete is the enrollment form. This form is only required on eligible patients. You see, this form is also shared with the Lung Project. There is a data dictionary that will allow you to answer each question correctly, and you should also use the insurance classification document. The B5 clinical data form captures medical history and tumor characteristics on the patient. You are encouraged to start with the consult note and then pathology to answer the questions. There's also a data dictionary that goes along with this form. The B6 systemic therapy form also has a data dictionary that you should use to make sure you're answering the questions properly. This form is completed at the end of treatment and should be updated 3 months after the patient ends treatment if appropriate. The SC2 early termination form is completed if the patient is no longer being followed or no longer participating in MROC for one of the reasons listed. If an early termination form is submitted, the forms listed at the top in red are required to be entered before closing out the patient's record. Lastly, we will discuss provider forms. Provider forms should be completed during the first on-treatment visit, so the first OTV week, the end of treatment, and during the designated follow-up time points. The provider forms can be completed by the treating physician, nurse practitioners, physician assistants, residents, or the clinic nurse. Provider forms can be completed during a virtual or an in-person visit as well. Here is an example of all of the follow-up time points. So if you look at the bottom 3 rows and you look at the B standing for breast project, each of the time points will tell you what form should be completed. So if we look at pre-RT eval, the B5 CDA baseline form and the B1 patient survey should be completed. And this goes on for each one of the designated time points. If a patient is receiving a 5 or fewer course of treatment, we have an abbreviated time point schedule. Please review this when appropriate.